So what can you do at home to better understand how you react to blood sugar and insulin surges? This is part 5 in my blood sugar series. So let's say you're a typical new patient. You feel like crap most of the time, and this is what comes in our office, especially in a functional medicine office. You've been to 10 plus doctors, you spent $30,000 out of pocket, and you say to me, I have a few dollars left for my help. You need to help me get out of this budget, and I want it done in 2 weeks. Well, that's not fair to me or the other doctors who are last stop, but I get it because I've been in that boat too. I've gone into other doctors and go, I'm just kind of tired of being in this process, and I've spent so much money on doing it. I get it. That said, when somebody comes in and they've done all this, I have the advantage of finding out what didn't work or what wasn't explained, because I do see doctors actually do really good work, but they didn't explain to the individual, this process takes 3 months. And they, in their head, when they walked in to start the treatment, they expected it to be 2 or 3 weeks. But those, I mean, clinically, you're looking at the research of what goes on. When people do this for 3 months, they get this result. But in like 2 months and 2 weeks, they feel nothing. So if you haven't been explained to that, it gets a little frustrating. So sometimes it's the right stuff, and I feel bad for them, because then they got to do it again, and that's just the way things go. But I get the benefit of seeing what didn't work and what did work, and hopefully try to see what we can do to phase it to completion. In other words, don't give up. If your doctor can't help you, or they can't help you understand the process condition, first thing, ask them for more information. And 99% of your health happens away from the doctor's office anyway. It's not your doctor actually making you healthy. It's your doctor giving you some advice, or whether it's a medication or a supplement or a diet or an exercise, and you going home and executing that. You are responsible for that. So over the past 25 years, misunderstanding has been the main limiting factor to why people remain sick. And it's worth taking the time for longer visits. So even when I see my doctors, I ask for more time. I want to understand their tests. I want to understand their plan. I want to understand their treatments. Where are they getting from point A to point B, so I can go, okay, that makes sense to me. And I trust what you're doing, but I need to have it in my head that more or less I came to the conclusion too. So while finger sticks are important, especially for checking keto markers and ovulation and blood sugar, and by the way, if there's insulin surges, there may not be an ovulation that's perfect. But also ovulation can cause insulin surges, just a heads up. Hormone imbalances, food sensitivities, finger sticks, you can get different things from that. There's something in the market that makes a more profound difference in understanding physiology. So did you know that dairy, corn, gluten, and sugar are all inflammatory? Well, if you did, great, high five. You did your research. But did you know that they can inadvertently raise your blood sugar because they're inflammatory? So what's more confusing, so can healthy foods. So for me, I didn't have a food sensitivity to turkey. I didn't have a food sensitivity to peppers, and that's with running IgG, IgA, and IgM, those type of antibodies for food allergies, food sensitivities. There's a difference, and I have a podcast on that too. But they raised my blood sugar as if I was eating donuts and drinking Coca-Cola at the same time. I'm not kidding, like 250 points. What? So what I found out is by using a continuous glucose monitor, I could find what my body was really doing in processing foods. Well, if I eat, let's say, a 95% clean. I'm not perfect, but I do eat pretty clean. But why on the earth, other than my resilience of beating myself up for many years, why on earth am I getting a fatty liver? And we saw that, okay, I'll take more of this and I'll do more of that, and then it got worse. And knowing I was treating it, knowing that I was going to other doctors, and knowing we were getting in front of it, and I got worse. It's because I kept having these insulin surges. Well, why am I having insulin surges? It's what you eat. So you can be like me, eat clean, gluten-free, mostly dairy-free, have very limited alcohol on special occasions, exercise now less than you did before, but more efficiently with high intensity and time, take all the supplements you need to that follow in your blood test, and still have a blood sugar issue. That sucks. I was not happy. So what are you going to do? So if you have a few $100s, and that's all it really is to get the information you need to get to your health, get something called a continuous glucose monitor, and it can be very, very helpful to guide your choices. Now, hopefully by now you've seen a patch on somebody's arm, or they're scanning their phone after they've eaten, or you've seen an ad for a continuous glucose monitor, or CGM as they're called, and they're typically used for diabetics, but it's a great and immediate biofeedback for a non-diabetic as well. First, you don't want to be a diabetic. Second, you don't know how you're going to respond to life. For instance, I like coffee. I used to take, or used to use a fruit gum, whether it's stevia or monk fruit, and put it in there as a sweetener. And then I'd use several organic creams, even bulletproof, which like has nothing in there. It's just a a powder form of a MCT oil. Nothing in my coffee has sugar, period. And I've been doing that for years, especially with knowing that I got into NAFLD myself. And then it went to NASH. And that was within the last 6 months. I recently had another CT, and it's like, oh, these things are progressing. And I'm like, what? So here I am going to the doctor, and who I see twice a year, and she's now referring me to a liver specialist, cardiologist, gastroenterologist, endocrinologist, rheumatologist, what the hell, because NASH is a bigger deal. And really until last year, I never really heard of it. So the particular CGM I use runs on Libre sensors, and they're kind of well known out there. But for me, it turns out certain coffees, certain creamers, and even something like stevia will take my fasting glucose, which might be 85 to 99, in a matter of minutes it goes up to 200. What does that do to my insulin? It raises it. And it hangs out there, not just for like an insulin spike that will go up for maybe 30 minutes to an hour. That hangs out there for 2 or 3 hours. So here I am doing, it didn't matter. Here I am doing AIP diet, which is autoimmune paleo, Whole 30, shape reclaimed, fast mimicking diet, carnivore, Mediterranean, you name it. And if I was using any of these things, and I'm just using coffee as an example, here we have turkey and peppers and other things that come along. It didn't matter what diet I was on. There was this massive spike of blood sugar. And as that blood sugar came up, it might as well just gone to McDonald's, might as well just had, it would have been easier for me to explain it my blood tests look like I'm eating candy all day long, and I'm not. And even through carnivore, the only thing I had was meat. And there were certain meats that were still raising my blood sugar and keeping my insulin high. And so what I was seeing with, here I am as frustrated as some of the people who walk in my office. And I'm like, I know better, but nobody knows this. And we couldn't have tested for this. And we read flu sensitivities and didn't show this. And we ran blood tests and it didn't show this. But here I am getting a real-time response of how my body reacts to food, how they create inflammation, what it's doing to my insulin, what it's doing to my blood sugar. And these are things you're not really going to find in the literature. It's going to be a trial and error that you learn on yourself. And the things that shouldn't have affected my blood sugar, in the case of most of the people who walk in our office, and probably you too, is that it wreaks havoc on the rest of your body. So I'm adjusting accordingly with this, including supplements and pharmacy. Got to do what we got to do. And I've read enough articles about pharmaceuticals and how they raise blood sugar too. So that's something we have to explain in our office. Hey, if you've got a medication, you got to see if it's going to spike that as well. and like sometimes allergy medications cause allergies, and sometimes blood sugar medications create blood sugar issues. That sucks. That's just, most people are like, that's just great. But this newfound knowledge with these CGMs can be a huge learning tool. And I might be motivated to let my children try it. I want to see what they know, how this happens. Hey, was Dad correct on how your mood, energy, attitude sucks with your diet? And that you're a pleasure to be around when you eat clean, and you're not so fun when you don't. Hopefully for them, whether youthful and invincible choices like I had, catch up to them, or are they getting away for now? So I hope I can only educate them to do the right thing, and i.e. see my genetic predisposition, as we talked about for a while. So I've documented everything in this process, including secondary non-response regarding digestion, skin, sleep, swelling, overall destruction of my skeletal system. There's a whole issue with that too. But what I do now in the training that I've done, running blood tests every 6 to 8 weeks, consulting the best doctors in the country, and about 24 diagnoses, some that stuck, and what's going on with somebody who just thinks this is aging and they push on day in, day out. There's so much more. There have been many days in the past year, or the past 4 years, I've considered just stepping away. I feel bad. And then certainly my stamina is not the same, and certainly I work way less hours than I used to. I've never liked the idea of not being able to finish something. For me, it's finishing my health journey right now, and that means I'm helping other people with their health journey. I've never liked just backing out. I didn't like to get into a race unless I trained properly. For me, I thought I'd trained properly for this to understand what's going on, and it turns out I didn't know enough. So in our office, we had to rearrange my schedule to be at maximum energy and maximum brain function. Because, for instance, if somebody comes into a doctor and the doctor hasn't slept for 10 days or whatever, they're not on. They're not on. It doesn't matter where you go. You anywhere, and somebody hasn't slept or isn't taking care of themselves or feels like junk, they're not on. And so I don't think it's fair for individuals to come see me if I'm not on. I have to be on. And so we reduce my exposure and my time that I have to be in the office to get maximum energy, maximum brain function. And then at the same time, even during the day, I watch my heart rate, my blood pressure, my heart rate variability, my oxygen, and other markers, so I know I'm not crashing, because I have to build this energy back so that my body can reverse this thing that's happened. I'm guesstimating that because of this, non-alcoholic fatty liver disease is going throughout the entire United States and world, that we have about 10 years in this country before we won't even be able to have transplants for liver, heart, kidneys, etc., because there will be too many people that need them and too few quality donors to donate. So we have two choices. You can get in front of this thing with yourself and your family, or pray that you have great odds in playing the transplant lottery. I'm Dr. Alan Trites. Be well.